We start today in Puerto Rico, where new vehicles were recently purchased for the Department of Public Security. Cars, trucks, and even ambulances will be distributed to the different divisions, all within the Department of Public Security, the Puerto Rico Police Force, the Firefighters Unit, and Emergency Medical Services, with most of those new vehicles going to the police force in 13 regions of the island. Our Francis Felix reports.
With an investment of about $28 million, Governor Pedro Pierluisi announced the purchase of vehicles for the Department of Public Security. Governor Pedro Pierluisi and the Secretary of the Public Security Department, Alexis Torres, details the purchase of 782 vehicles for the Firefighters Department and the Department of Medical Emergency. The Public Security Secretary detailed the importance to give the necessary equipment for the police department, firefighters, and paramedics.
I think it's very important for us as the Department of Public Safety to be able to respond to the people of Puerto Rico in any emergency situation. So that's pretty much what we did here. We combined some funds from the state side and federal side, and we purchased this equipment.
The labeled units and the ghost vehicles are essential to carry out preventive rounds and patrolling on public roads for the prevention of accidents and interventions with those who violate traffic laws and put their lives at risk.
We purchased patrol units, which are going to be assigned to the different highways throughout the 13 different police stations. Also, we purchased 17 to 20 ambulance and 10 firefighter trucks. So they're going to be distributed throughout the island in different stations. And the purpose is to respond to an emergency. Pretty much what we're doing is we're trying to actualize the update the different fleet that we had in all the different bureaus within the Department of Public Safety by purchasing close to $30 million in equipment this time.
Also was confirmed the distribution of $5 million in incentives to the municipalities that are part of the 911 emergency system. From Guaynabo, Puerto Rico, Francis Felix.
All right, thanks so much, Francis. Well, meantime, Jamaica's Finance and Public Service Minister, Dr. Nigel Clark, has appealed to government workers for patience and calm regarding a compensation review that is underway. Several public sector employees took industrial action last week to protest the slow pace of the review, but Dr. Clark urged restraint against further industrial action, which he said could interrupt and reverse the island's economic recovery.
A reversal would set Jamaica back tremendously, costing jobs. This would negatively impact us all, from the decline in government revenues that would follow and the cuts in budgetary expenditure that would then become necessary. Jamaica cannot afford this. On behalf of all Jamaicans, therefore, I appeal to all public sector employees for patience and for calm.
The minister said things will be much clearer once consultations with unions or bargaining groups have been completed. Clark disclosed that his ministry has already met with 45 of 47 central government bargaining groups and unions, and he assured that no public sector employee will be worse off after the exercise.
We are aware that in any set of proposals designed to cover 110,000 public sector employees, there could be cases where the proposed changes lead to less net pay. What the assurance instead means, however, is that wherever through reasoned, objective, and data-driven feedback, it can be proven that someone would indeed be worse off, we will work to find a fix.
The public sector compensation review is intended to overhaul the structure and salaries and other employments in the public service sector. It will simplify the current complicated 325 salary scales and eliminate most of the 185 allowances. Well, meantime, a teenager is dead and another is hurt after a sand collapse at a New Jersey beach. Authorities say two siblings were digging in the sand when they became trapped after the sand collapsed on top of them. Emergency crews worked to free them and were able to rescue a 17-year-old girl. Unfortunately and sadly, her 18-year-old brother died at the scene. Police say the two were visiting from out of town with family. And switching gears to the latest on the COVID-19 front, as COVID cases are trending up in all but 3 U.S. states, the FDA has now authorized a new, first-of-its-kind, over-the-counter COVID-19 test. And also today, the agency has given the green light for booster shots in kids 5 to 11. Mandy Gaither has more.
Across the U.S., new COVID-19 cases have more than doubled over the past month. The Northeast hit especially hard. More than 40% of people there live in a county with a high community level. That means universal indoor masking is recommended.
We still have a lot to do with regard to vaccinations, with regard to boosters, with regard to making it very clear that we have antivirals that are available for people, particularly those who are at high risk.
Testing, another weapon in the war on COVID-19. The FDA has now cleared a new over-the-counter test unlike any other. Using a nasal swab sample, it can test for COVID, flu, and RSV at the same time. Those samples are then sent back to the test maker for testing. Results are delivered through an online portal. The test can be purchased online or in a store without a prescription. Meanwhile, the American Academy of Pediatrics reports new COVID-19 cases among U.S. kids is up for the 5th week in a row. On Tuesday, the FDA gave emergency use authorization for a booster dose of the Pfizer COVID-19 vaccine for children 5 to 11 at least 5 months after their initial series of shots. The company says a third vaccine dose raised Omicron fighting antibodies by 36 times in this age group.
Now, the CDC is also updating guidance for those traveling within the U.S. The agency is urging domestic travelers to get tested no more than 3 days before your trip, even if vaccinated and boosted. Travelers are also being asked to get tested after travel, especially after spending time in crowds without a well-fitting mask.